The systematic use of antibiotics wears down a patient's native microbiome and immunity from infections. C. difficile colitis, a commonly recurring gastrointestinal infection, is mainly caused by prior antibiotics. Nevertheless, we still rely on antibiotics to treat this infection. Fecal microbiota transplants have been an effective substitute, where a healthy microbiome is purified from stool and administered to a patient. However, it is overall strictly regulated to only treating recurring CDIs due to the dangers of unscreenable transmissions. Stronger screening methods have been designed, yet they don't last in face of germ evolution, and they also limit microbiome diversity, which is tied to transplant effectiveness. In face of this challenge, we propose Capsule Corps, an ingestible capsule that segregates the transplant microbiome in the patient's stomach for around 30 days and treats the infection via antimicrobial peptide diffusion and resource competition. The device is ingested as a small sphere, which is much less invasive compared to how FMT is commonly delivered, colonoscopy. It is wrapped with soft hydrogel that expands in contact with water and keeps the device afloat in the stomach. The device contains a membrane mimic that allows only selected molecules to pass and treat the infection, as well as an energy harvesting system which powers monitor sensors. In case of emergency or treatment ending, the transplant can be removed safely by taking calcium chloride, as an additional distinction in risk aversion. From this, we anticipate great traction. The total U.S. market size of CDIs per year is more than $380 million. Since C. diffs are highly antibiotic resistant, doctors would see us as more cost efficient. And since we are creating new markets that current FMT products have not tapped into, there would be collaboration rather than competition. The next step is to utilize the reputation and gradually lift bans to treat other diseases. These include many common gastrointestinal infections and mental disorders that FMTs have a promising track record with. Finally, since Capsule Corps represents a larger model of in-body molecule production, if engineered microbiome is sealed instead, this non-invasive model has potential to treat not only infections, but lists of deficiency conditions like diabetes. Considering this potential, we invite you on our endeavor to fulfill the untouched perspectives.